Hello everyone. Today, we're diving into the world of a medication called Adalimumab-adaz, commonly known by its brand name, Hyrimoz. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Adalimumab-adaz, often recognized by its brand name Hyrimoz, is a biologic medication that falls under the category of TNF, tumor necrosis factor, inhibitors. Its primary function is to reduce inflammation by blocking the activity of TNF, a substance in the body that causes inflammation. Initially approved by the FDA, it's used to treat a variety of autoimmune conditions. These include rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, Crohn's disease, ulcerative colitis, and plaque psoriasis. Additionally, Hyrimoz is prescribed for juvenile idiopathic arthritis in children and for hidradenitis suppurativa, a chronic skin condition. By targeting and neutralizing TNF, Hyrimoz helps reduce inflammation, pain, and damage to joints and tissues. Warnings: Hyrimoz comes with its set of precautions. It's essential to be aware that it can lower the ability of your immune system to fight infections. Serious infections, including tuberculosis, TB, and other bacterial, fungal, and viral infections, have been reported in patients using Hyrimoz. Before starting this medication, you should be tested for TB. Those with a history of recurrent infections or other conditions that predispose them to infections should exercise caution. Additionally, Hyrimoz can increase the risk of certain types of cancer, including lymphoma. It's crucial to discuss your medical history with your doctor to determine if Hyrimoz is suitable for you. Before taking this medicine. Before starting Hyrimoz, several factors need consideration. Inform your healthcare provider if you are allergic to Adalimumab-adaz or any other part of the medication. Given its impact on the immune system, those with a history of infections, TB, or who have been in close contact with someone with TB should discuss potential risks and benefits with their doctor. It's also crucial to inform your healthcare provider if you have a history of cancer, heart failure, hepatitis B, nervous system problems, or if you are scheduled to receive any vaccines. If you are pregnant, planning a pregnancy, or breastfeeding, it's important to consult with your healthcare provider to understand the potential risks and benefits of using Hyrimoz during this time. Regular monitoring and follow-up appointments are necessary to check for side effects and to ensure the medication is working effectively. Side effects: all medications can have side effects, and Hyrimoz is no exception. Common side effects include reactions at the injection site, such as redness, swelling, or pain. Some individuals might experience upper respiratory infections, headaches, or rash. More serious side effects can occur and should be reported to your doctor immediately. These include signs of infection, fever, chills, sore throat, allergic reactions, hives, difficulty breathing, and signs of liver problems, jaundice, dark urine. Additionally, Hyrimoz can cause blood disorders, nervous system problems, and heart failure. Symptoms such as unusual bruising or bleeding, numbness or tingling, vision changes, or swelling in the ankles or feet should be reported to your doctor immediately. It's also important to be aware of the potential risk of certain cancers, particularly lymphoma and skin cancer, while using Hyrimoz. Regular checkups and communication with your healthcare provider are crucial to monitor for these serious side effects. Interactions: Hyrimoz might interact with other medications, increasing the risk of side effects or reducing its effectiveness. It's essential to inform your doctor about all medications, supplements, and herbal products you are currently taking. This includes other biologic drugs, live vaccines, and immunosuppressants. Dosage: correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking Hyrimoz. The usual dose for adults with rheumatoid arthritis, psoriatic arthritis, or ankylosing spondylitis is 40 mg every other week, administered as an injection under the skin. For Crohn's disease and ulcerative colitis, the dosing schedule may begin with an initial higher dose, followed by maintenance doses. For plaque psoriasis, the initial dose and maintenance dose may vary based on the individual's response to treatment. It's important to follow your healthcare provider's instructions regarding the correct dosage and administration technique. Avoid: while on Hyrimoz, it's advisable to avoid close contact with individuals who have infections, including tuberculosis. Given the increased risk of infections, it's important to avoid live vaccines. Always inform your healthcare provider about any upcoming vaccinations. It's also wise to avoid alcohol if your doctor has advised against it, as it can exacerbate certain side effects. FAQ. Many wonder about the age restrictions for Hyrimoz. While it is approved for use in children with juvenile idiopathic arthritis, its safety and effectiveness in other conditions for individuals younger than 18 are not well established. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of Hyrimoz. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.